Hi friends, this is Deidre with Enjoy Wellness Movement, showing you one of my favorite techniques for myofascially releasing the calf and the hamstrings, the whole back of the leg area. So my favorite way to do it is to use a rolled up mat. I'm going to show you some different options though, so don't worry if this one doesn't work for you personally. First position is right behind the knee crease. So to really get that right behind the knee crease, you have to really come forward to open up that space. And then I just kind of well, not that vigorously, but just put the mat there, hold it there, and come back to slowly put your weight down into it. This might take a little bit of time before you can actually sink down. So if it's like really intense at first, you might actually hold your weight up a little bit. I watch the position of my ankles because sometimes I'll go into some weird funny splay things that you might actually overstretch the ligaments of the ankle. So try to line them up as best you can, ankle with knee joint on both legs. So take a peek back there. Sometimes I'll click my toenails in a little bit into the floor and then just sink down again. We'll be holding this for a little bit of time. So you hold while I offer some options for you, okay? So there's a couple of reasons that this may not work for people. One is that they don't have the availability for extension in the ankle, for your ankle to be like this. So this might hurt your ankle joint. If that were the case, lots of options for you. This is just a little neck pillow. You could use a neck pillow to put underneath there and just slide it under your ankles. You can see how that gives your ankles a little bit of support there. If you don't have a neck pillow like that, you could use a half roller. This is kind of a cool little device. I'll show you some more with that later. But a half roller works really well for this technique if you don't have that ankle flexibility. Another option, if you don't have those tools, don't worry. I'm guessing you have a towel or a blanket. Okay, I just rolled a normal bath towel. Just put it in a roll, and that gives your cushion, your ankles, some nice soft cushioning. And so that might alleviate the ankle issue for you. Okay. Another issue that you might have is, of course, the inability to go into this much knee flexion. So if you've had a knee replacement or any traumas to the knees that this is just painful to the joint, then that's your body's wisdom saying, that's not right for me. So what could you do about that? One thing you could do is try to grab a block and sit up a little higher. I don't have 2 blocks around me right now, but if you did, you could actually build yourself a little block tower to come up higher. The higher you come, though, the more you're going to decrease the pressure into the calves and the hamstring tissue, which may or may not be appropriate for you. So that's one thing you could do. You could also use the block if you need to come up a little bit higher and have some leverage, okay? Or you could be like by a end table or this little piece of furniture that I have. This is actually one of my favorite ways to multitask when I'm on my computer. So here I am doing my calf work while I'm getting my emails cleared through or whatever. So if this doesn't work for you, or you don't have a yoga mat, you could use just the rolled up towel. Please stay there for a little bit longer. Okay. So you could use a rolled up towel. That might work a little bit better for your body or your positioning. You could actually make this a lot thicker too. You could use a thick towel, roll it thicker so that you have a little more cushion. Could use the half roller here if you wanted more emphasis on your hamstrings, then I would put the rounded side up towards your hamstrings. If you wanted more of the emphasis down in your calves, I would put the flat side on your hamstrings, rolled side on your calves, and sit back. Some people will actually love to use their full-size foam roller. If you know anything about me, I only recommend the soft. So this is an OPTP soft foam roller. Soft is the important part. The hard ones are just too hard. They force the tissue for most people. So the soft, I would highly recommend. This doesn't work for me because I'm a little vertically challenged, so I don't have a whole lot of leg room. So when I use this, I can't get that position to gap the knee that I really like for the health of my knee joint. I can get onto the medius part of my calf here. So, I could work a couple of the different positions. We're gonna work 3 today. So, but if you have really long legs, you might be able to make that work. But for the gapping of the knee joint, which is part of the therapy of this, I really like the mat best, just because I can really stick it into that knee crease more, and then you gap the back of the knee joint, which really helps with production of the synovial fluid and the health of your knee joint itself. Okay, second position, go ahead and come on up, and then move that to the medius part of your calf. Okay, so this is where you're going to see that teardrop shape, and then, you know, traditionally if we were talking about muscles, which I don't like to talk about individual muscles much anymore, because that's just where we cut the tissue off the bone, put it on a table and labeled it. We don't have individual muscles. We have one connected fascial body. So just get into thinking globally instead of pieces and parts. You're not pieces and parts. Second position is right there. So in any of these positions, once I'm hanging out here for a while, we're giving it time, okay, at least 5 minutes in each position. That's just a myofascial principle. Give it 5 minutes in each position. At that 5-minute level, you start releasing interleukin 8, which is a natural anti-inflammatory, very important for us. Interleukin 3s get released. That increases the stimulation of white blood cells, which helps your immune system. Okay, pretty important reasons to just stay in there for that 5 minutes. That's when we start moving past that elastic component of the fascial fibers and more into shifting the collagenous state of your being, so the fluid state of the environment of your cells. So we're changing jerky to filet. I love that analogy. So go ahead and sit there. And then if you're somebody that's just like, yeah, I got nothing, I feel really good. One thing that you can do, I'm going to turn so you can see this movement a little bit more, is to shift laterally. And I'll do this a lot because it's very common to have issues on one side and not so much the other. So all I'm going to do is bear down as much as I comfortably can, and then lean, just lean. You're still trapping the tissue and you lean, so you get a tissue drag. And this tells me more about what's happening on this side of the body. So I'm leaning in, I pause, have the audacity to take a conscious pause there. Listen to what your body's saying. My body's saying, that actually feels pretty good. Okay, and then I'm going to go over the other direction and see what my body has to say here. So go in without expectation, just get really curious about what's going on. I'm so curious about what's going to happen when I shift to this side. This side it's interesting. I feel actually more in my hamstrings, which is unusual. Most days I'll feel more in lateral calf, but so yeah, I'm just listening in. When I find something really interesting where my body goes, hey, what's that about? And my awareness gets drawn there fairly strongly, those are the things you want to look for. Those are your staying points, your sticking points. So just hang out there longer. Okay, so sometimes you can do movement, but the movement is just for the posing of the questions to the body. And then when you go, oh, right there is the perfect spot, then the staying is the therapy. So then you just want to stay and you want to sink. And you want to breathe. Absolutely, you could multitask. I'm very honestly quite a multitasker. So I might be here working, you know, if you're a lifter, you could be doing some curls here if you want. But that's if you're at that state where you can really hold awareness and shift your awareness to different places. So sometimes if we start adding too much, we actually take away from the listening aspect. So we're not here trying to pump out reps to fidget through, to just get through our thing. This is about actually spending time with yourself, really quality time, which means like, hi, I'm here for you. I'm listening to you. I'm like honoring what's happening in my body right now. I'm listening to whether I'm pushing too hard. Am I forcing an agenda on my body? Please don't do that. Can I be here with kindness and compassion? Or am I in a litany of thoughts about my bad knee? Or, you know, so you're watching yourself on all these different levels. So really stay in tune to what's happening right here in this moment. Like go inside your body and listen. Third placement. So go ahead and come off. Third placement, and by now the mat should be like squished, distorted into a different shape. third level is right down above the heel onto what you commonly know as the Achilles tendon, and then just come back here. Now this might be where it's too much pressure for your ankles. So maybe the first positions were just fine for your ankles, but then you get to this one and your ankles go, oh wow, that's a lot more pressure on my ankles. Then at that point, just support yourself at that point. So you could use, again, you could use a rolled up blanket, you could use a towel, you could use a pillow. Get creative, okay? You're not gonna screw this up, okay? So go easy on yourself. Be so kind to yourself. You've got this, okay? So on this position, tissues really feel really good for me personally. I'm gonna shift side to side just to make sure. Yeah, I've really, this is a place where I just get to be super grateful. I'm like, nah, that feels great. Second position, a little more interesting for me. Quite a bit more interesting for me. And then that first position, oh yeah, when I rock, which I didn't rock in the first because I was explaining to you, most interesting to me. And most interesting off to one side. So that's where I would choose to treat. I don't waste a whole lot of time with areas of the body that feel great. I just consider, hey, I have no issues in the tissues there. That's a moment for me to just be super grateful. So moment of gratitude. Thank you, body. I love that. You feel great. I'm going to find something that needs a little bit more of my attention. So super valuable technique to treat the whole back of the leg. When I'm done with this technique, I go ahead and release the mat. And then I do stretch out release the back of my knees. So I just open them up. So you could open them up one at a time and hang out there for a little bit. If you love down dog, you could certainly come into downward facing dog and maybe even dance it around a little bit, get playful with your dog. So that technique is sometimes referred to as calf smashers. Please think of it as calf lovers. So that's my favorite calf loving technique. Have a beautiful day. I love you.